Hi, this is Dr. Greg Oliver at Fat Doctor TV. Today we're going to talk a little bit about high blood pressure or hypertension. Now, there is a direct correlation between high blood pressure and weight. Yes, there are some thin people that have high blood pressure. High blood pressure or hypertension is a genetic disorder again. Many of these are passed on from family member to family member, and so you may well be very fit, very healthy, very lean, and still have high blood pressure. It needs to be treated, and that can be treated nicely with medication. For those people that are overweight, though, high blood pressure is a significant problem in many cases. The other thing we know about high blood pressure is the older we get, the greater likelihood we are to have high blood pressure. And a lot of that stems from the fact that as we get older, our blood vessels become less elastic. Sometimes we do gain weight as we get older, and so we have more resistance that we have to push the blood through, and more tissue that has to get blood, and we have to push the blood to that tissue, so the blood pressure generally will go up some. And we know that statistically, by the time people are in their 70s, probably pretty close to 70% of people will have high blood pressure. Now, if you have high blood pressure and it's related to weight, which we see that tremendously in our society and in my practice every day, people think, well, if you're 100 pounds overweight and you have high blood pressure, you have to lose 100 pounds to get your blood pressure down. That's not true. We know that just a 10-pound weight loss can make a significant change in your blood pressure. Certainly a 20-pound or 30-pound weight loss will make an even more significant decrease in your blood pressure. So every pound that you lose takes away some of that resistance that your heart has to pump out against, and also tends to be healthier for your blood vessels. Now, what happens if you don't treat high blood pressure? Well, over time it damages our arteries. It increases the risk of atherosclerosis, or hardening of the arteries, or plaquing in our arteries, and which can lead to things like heart attack, stroke, organ disease such as blindness, kidney failure. So the end results of untreated and uncontrolled high blood pressure are really very similar to the end results of uncontrolled or untreated diabetes. They all end in what we call cardiovascular disease, cardiovascular events, and premature death. So it's extremely important to pay attention to your blood pressure. Now, unfortunately, I get a lot of patients who go, well, I never really check my blood pressure. That's really important, and you can get it checked anywhere. Now, if you decide you want to be aggressive with it, you can purchase your own blood pressure cuff. You can get those at any pharmacy or big box store. Now, don't get out of control with it and take your blood pressure 10 times a day. That's not necessary. But taking your blood pressure a couple of times a month randomly is a good idea. Now, if you don't want to purchase the blood pressure cuff, most places that have a pharmacy, whether it's a CVS or Walgreens or your local pharmacy, possibly a Target or Walmart or Myers, some big box store out there, they also have blood pressure cuffs. A lot of the malls that you're in have blood pressure cuffs. People always say, are those accurate? Well, probably pretty decent, okay? It's more accurate than not getting a blood pressure. At least it gives you a good range of where you might be. And if that is high, then you need to check with your doctor. So today, focus on blood pressure, and here's your assignment. If you haven't had your blood pressure checked in some time, make it a point by the end of this month to get your blood pressure checked somewhere. Our office, we provide free blood pressure readings. Anyone who walks in the door, we'll take them back to our check-in station, check their blood pressure, let them know what it is, and send them on their way. So check with your doctor. They may offer the same service for you also. So get your blood pressure checked. If it's higher than it should be, which would be certainly in the treatable ranges over 140 on the top number and 90 on the bottom number, then you need to get to see your doctor or healthcare provider right away. All right? So that's enough for blood pressure today. Get it checked, get it taken care of, and stay healthy. And if your blood pressure's up because you're carrying around too much weight, knock it off. Bye now.